Mm-hmm.
So tell me, what are some of the things that you want to achieve and what are you looking for?
Really just, all size and fullness, really. I mean, I'm obviously smaller. I'm petite. I've always been petite.
Yeah.
And so, yeah, just...
So a little bit more fullness, a little bit more size. As far as the outcome, I mean, are you looking for something that's like very natural?
Yeah, more
or
natural.
Kind of natural plus, or kind of like augmented?
Like
That's kind of the hardest thing to work
natural,
through.
really. I mean, I don't want it to be like, obviously, like super noticeable, like I'm in a swimsuit. I've noticed that, like, in a swimsuit you can
That's
tell
a good distinction.
more.
Yeah. So like if you were in a swimsuit and you met someone you've never seen before, what would you want them to know or think? Would you want them to be like, she's had a breast augmentation, or would you want them to be like, I don't know, maybe?
Yeah, I don't know, maybe, probably.
Okay, that helps me a lot, because I think that's definitely more of a natural kind of look.
Yes.
And what that means is that there's not as much roundness to the upper part of the breast. It's just fuller.
Like cleavage-wise.
Right,
yeah.
It's just not as pronounced.
Yes.
Now you could always do that with, push-up bra or whatever,
yeah, exactly.
But it won't be there like permanently.
Yeah.
And so that gives you a little bit more natural look, such that no one is going to be able to tell for sure.
Yes.
Okay. All right. And then what cup size are you now?
An A.
A. Okay. And then looks like gold, maybe C-ish kind of range. Okay.
Yes.
Then the size is kind of once we know what kind of outcome you want, then we kind of get the measurements of like what your breast width is.
Okay.
And then we can kind of get the volumes and see the range of the cup size you would be eligible for. And we'll do that in a few minutes.
All right.
But in general, breast augmentation is an outpatient operation. Most of the time I recommend putting it underneath the muscle. Okay, that protects against capsular contracture. It also helps with a little bit more natural transition of that upper pole of the breast, so you get something that looks more natural. We use smooth implants. They're round. They're very soft. I think silicone is an option. It is pretty good. Silicone is better just from a cosmetic standpoint, but it's not that saline's like awful or anything.
Yeah.
I would say it's probably 20% better.
Yeah,
roughly.
I've heard of people like rippling or like it.
Right.
Yeah, and obviously the saline can be absorbed and the silicone can't.
Yes.
So it has,
Yeah.
I've kind of researched into it a little bit and, talking to people who have had it. So, I mean, I think I'd prefer the silicone. But...
Yeah. Well, I think most people do.
Yeah.
Most people get the silicone implants, but I think one thing to think about is, implants are not like a lifetime device.
Yeah.
They only last for so long, and you have to have them exchanged. And so that's the way you play it with the saline versus the silicone is very different. So saline, I mean, if it ruptures,
Yeah.
It could be 12 years, it could be 20 years, whenever it happens, it happens. Well, silicone, you have to be a little bit more proactive about it.
And get checked.
Exactly.
Every couple of years.
Exactly. There's a little bit more commitment to it.
Okay.
And you're kind of signing up for another operation, in 12, 15 years.
Exactly, later on. Which, I mean, I'm not, worried about that part of
Yeah.
that aspect.
It's a relatively small procedure to do, but it is just something that you have to think about.
Okay.
So we'll do an exam now. Take some measurements and we'll figure out, the sizes and stuff like that, okay?
Okey-dokey.
Okay, I'm gonna step out. Kendall will walk you through this next part and I'll be back in a minute.
Okay.
Okay. So usually one side is a little bit bigger than the other. And they're a little bit different. That's always the case. Arms down by your side if you don't mind. And we're just gonna go like that. I'm gonna scoop this hair back a little. Okay. So this breast, everyone's like this.
Yeah.
This breast a little bit lower. This breast a little bit higher. So there's a little bit of asymmetry. So we gotta think about. And so what that means is afterwards there'll always be like a little bit of asymmetry.
Okay.
Nothing major, nothing worse than it is now.
Yeah.
But it's just kind of hard to make
It's
that.
not super noticeable anyway. Yeah.
Right.
So.
I mean, it's something you have to really study. But after breast augmentation, everybody studies it. And they're
Yeah.
like, wait a
Right.
minute.
Yeah. This isn't right. Yeah.
Yeah.
No.
So you're starting off a little bit asymmetric, which is completely normal. Everyone's like this. All right. So we're around a 12 and a half. Okay. And then, as far as the closeness of your breasts, I mean, there is a little bit of space in between here. Now, if we were to kind of narrow that down a little bit, is this, like if you look at that space,
Yeah.
Or is it something that you want more something like that?
Closer together.
Closer
for sure.
together. Okay.
Mm-hmm.
One thing to point out is that the closer we get together here, the wider it gets on the outside too, because you have to center the implant right here, and so it's obviously round. And as you get wider going out medially or towards the center, you also get wider this way.
Okay.
So that's something to think about too, because that means it'll come out a little bit like this.
Okay.
And then the other thing we need to point out is the direction that your nipples face will be the same direction afterwards.
Okay.
We can't make
and more naturally is going to be obviously more.
A little bit to
okay.
the side.
I get what you're saying.
Yeah. So like very few people have a very flat.
Well, because when you put it in a bra or what, it's going to be obviously closer together. So
Yes.
Yeah.
Exactly.
I get what you're saying. Yeah.
Okay. I would recommend making the incision under here. Just along the fold here.
Okay.
And the same thing over here.
Okay.
And I hope to kind of adjust for some of the differences in the asymmetries between these two folds a little bit, maybe make it a little bit better.
Okay.
Okay. Okay, cool.
So that is 300.
Okay.
Put on your shirt because it's kind of funny to have them sticking out out of there. So 300, 350, either one is probably going to be.
They don't look like I'm proportional.
No, I mean, no. 300 is like the perfect size.
Yeah.
350 is like the perfect size for somebody that's petite.
Small. Yeah.
If you go any bigger,
It's
you're
gonna
going to look
look
augmented
yeah.
regardless.
Okay.
So
I mean,
we can try bigger just so you can see. But
yeah,
honestly,
we can try it, but I mean,
so-
I really like,
Okay, and then when you have the surgery, he will take sizers to the OR. So he'll put in an implant and then he'll fill it up with saline and say, okay, that 300 looks a little bit too small for her, or she wanted a little bit bigger, or kind of. So we're just trying to find out the look that you want, and then he'll figure out the actual size when you're in surgery.
Okay.
So it'll be, he wouldn't go any bigger than like the 350 now. You can just lift it up.
Oh, okay.
To take it off. Okay.
What do you think? Too big?
I like the
other ones.
better,
Yeah, I did too. Yeah,
I think so too.
Yeah.
It looks too big.
Yeah.
Okay. Perfect.
Hey, we're going to look at our patient who is 1 week post-op from a breast augmentation. Hello.
Hi.
Hi there.
You don't realize how much you use your upper body every day.
Correct.
So that was about the only thing I was like really shocked about.
Okay. Did you have to take a lot of pain medication?
No, actually, I really was just Advil. I mean,
Some
it
Advil.
worked.
Good,
Yeah.
good. That's the goal.
Tylenol.
Yeah, the goal is to not have to take any.
Yeah, I didn't really feel like it was like that bad of pain where I was just, I was laying down. So.
Okay, good. And it does take a while to sort of get used to using your arms effectively.
Yes,
Yeah.
it was just like every time I would get up, I had to use your
Yes.
upper body. So it's like,
Yeah.
wow,
But
this is just.
How long did it take you to kind of get over that part? About a week?
A week.
Okay.
It was like really 5 days.
5 days of kind of getting used to the uncomfortableness of surgery.
Exactly.
Okay.
And it was really just tight feeling, you
Yeah.
know? So
Well,
it was like uncomfortable for me to.
Yeah, and that kind of relaxes over time. That's
Oh,
gonna
yeah,
get better
yeah.
and
It's
better.
already a lot better.
Good,
So.
good. So, super. You're healing very well. And
Yeah.
I think, we're really waiting on this part to kind of stretch out a little bit more, and then there will be less volume here and a little bit more volume down here.
Okay.
That just takes a little bit of time. But
Yeah.
everything looks good. Looks like you're healing real well. Any questions for me? I mean, I think now we have to start talking about what you can and can't do, because you're going to start to feel like, well, I can do a whole bunch of stuff, but maybe
No.
you shouldn't.
Exactly. I mean, I've been trying to like kind of walk and stuff just for like 30 minutes. I mean, because I used to walk every day, so it's
Yeah, I
kind of
would
like
think that-
then,
Been a little,
and
hard.
exercising and stuff. I don't do that.
Yeah, I would say
kind of
walking.
ease into it.
Exactly. Walking's fine. I wouldn't do anything that's, with your arms, like lifting your arms up over your head or anything like that. Obviously, using your arms up in front of you, that's fine. I wouldn't do anything that's like physical, like getting your blood pressure up, your heart rate. Now, walking, totally fine. Right, that's a kind of different thing. But just be careful. I think things are healing well. They're still a little bit vulnerable to, you know, any sudden movements or sharp kind of or really vigorous activity, but everyday activity should be fine. So, obviously, showering and stuff like that's okay. I wouldn't get in a tub, like submerged underwater yet, or like in an ocean or anything like that, just not quite yet.
Okay.
So why don't we check back in like 3 weeks, and then we'll be able to look at the incisions and make sure everything's good.
Okay.
And if everything looks good at that point, we'll kind of talk about what you can do next as the next steps.
Okay, awesome. Okay. So I'll just listen to my body basically.
That's right.
Go on.
Yeah, it takes a little bit, but you're doing great. You're doing great. Any questions about any of that stuff? Okay.
No, we're good.
Okay, great. All right, well, we'll see you soon, okay?
All right.
All right.